I don't believe I did. No, I don't think so.
I did know there was 2 different types. Not really sure what the difference is.
No, I did not know there were 2 types of bipolar disorders.
Not before a few minutes ago.
I didn't actually.
Yes.
Give me a hint.
I would say the first one's really severe. You go through severe depression or severe happiness, you know, and then the other one's just slight changes you can barely tell.
One, you get sad and happy. The other one, you get mad and happy.
I think that one is characterized by like more extreme highs and lows, or maybe like they last longer or something. I'm not really sure.
The difference? No.
Is it manic depressive and then hypermania or something like that? Or it's like bipolar 1 and bipolar 2?
No, not off the top of my head.
I know that it's a mental disorder where one who's affected by it suffers through manic episodes and episodes of depression.
I know they have mood swings. Sometimes they're irrational in the way they act. It's like hot and cold. You don't know what you're gonna get with them.
That it can, switch your mood by any kind of at any time.
It's characterized by like moods between mania and depression, like highs and lows. So sometimes they have a lot of energy and they're really happy, and then other times they have like depression symptoms.
I know that when, like if you're bipolar, you go through the changes in longer lengths than people think.
I know that it's characterized by extreme highs in mood and extreme lows by mood. It's often misdiagnosed as depression because people usually go in when they're feeling low, but don't really talk about their highs.
Like major like mood swings, like you can be like really happy or like, and then like.
Only the things that I've read, and I don't always believe everything that I read.
I don't know, it's triggered by environment.
That is like your emotions shift uncontrollably after certain life events.
I've had 3 friends that have had it, and one of which I live with.
Okay.
And I know that she goes through bouts of mania where she cleans the entire house in like 5 minutes, not really, but like an hour. And then when she gets really, really depressed, she has problems with like self-harm, and she doesn't tell me. So.
I guess it would depend on how severe the disorder was.
Normal until they're triggered.
One minute they'll be okay, you know, happy-go-lucky, and the next minute they might be like very depressed and sad, don't want to do much of anything.
Some people function normally in society, and some have to take medications for it.
I did, but I did know that how people, because I watched a video recently on kids who are bipolar, and that there are 2 different types, like some are more calm than others, but I didn't know the names of the 2.
It affects them in their social skills and their way of life.
I do have a friend of mine who says that she has bipolar disorder, and I know that there is a varying degree of emotional strife within bipolar disorder, and even some difficulty functioning and organizing. So I think it's multifaceted, and there's a lot to it, and it's not easy to describe or define.
Can act normal.
I would assume they act similar to people with depression, so, but they're probably, like people with depression, they're probably also good at acting like everything's okay, so I probably don't really act that different.
I feel like they act a lot like depressed people if you catch them, if they're like, because typically the lows are a lot longer than their highs, so I feel like they typically act like your depressed person, but other than that, a normal person.